Hi, it's Joe here at WDC Physio. We're talking about cervicogenic headaches. So those are headaches which come from the neck. So you can normally tell that you've got a cervicogenic headache if your pain comes alongside, say, sitting down or driving or a sustained position of some kind, and they tend to be sat at the back of the head or sometimes further into the eyes and at the front of the forehead. Sometimes they're more one side than the other. Okay, so what we're looking at avoiding to correct this position, so the issue is we sit for long periods of time in this position. So if we're sat at the desk, we tend to sit, chin drifts up, head drifts forward, we compress everything at the back of the neck, which compresses the joints of the neck, which gives you that kind of pain and irritation around that area and tightens up the soft tissue. So number one is correct the position. So what we're looking for are, to give a floaty kind of cue, we're looking for the head to be drawn up towards the ceiling. So we're looking for a straight back of the neck and we're looking for chin down. So when you're doing something in daily life, if you tend to drift into this position, you'll be compressing those joints. So if you want an exercise to reinforce that, we talk about activating some of the deep muscles of the core muscles of the neck. So we can do a really, really good exercise lying down where just from that position, we're looking to get rid of this gap underneath the head. So we just draw the chin down and we use some of the deeper muscles in the neck to do that. So we keep the back of the head on the floor, we draw the chin down and we're looking for that tension in this area. Really, really big key to these though also is that when it does feel a bit looser or when we are starting to kind of make some progress with learning that position, is that also we're getting rid of some of the pain and the tightness in the back of the head. So we can use spiky ball, tennis ball, any kind of massage ball you've got, which is a really, really good tool for loosening off some of that tightness that sits in that area. So what we do is from that same position on the floor, we can just take that ball into the tight area. So we've got two muscle groups we're working on here really. One are the sort of paraspinal muscles, so the groups of muscles that go down the sides of the neck and plug in at the top, and then two are some of the muscles higher up into the head. So all we need to do is take that ball, put a little bit of weight, a little bit of pressure through the head, and then roll into those tight areas. You'll feel all of that tissue starting to release off a little bit as that pressure is kind of like self-massage work. So we're stimulating blood supply to the tissue, and we're starting to encourage some healing in that area. So it's a couple of quick tips for cervicogenic headaches. If you've got any questions, just leave them in the comments below on the blog. Thanks.